Before you set up formal appointments in this office, I have a process that I would like for you to go through. Now, you might be wondering why that is. With most doctors, you just call up their office and you make an appointment. Maybe you need a referral from another doctor, but it's not that complicated a process. But in my particular case, I want to be sure of a couple of things before we set up appointments. One of them is that you understand what you're getting into. The other is that I'd like to review some information about you to be sure that I think there's a reasonable chance that this is a good fit for your particular situation. So first off, I want to be sure that you understand that this protocol involves modifying your diet, taking a lot of nutritional supplements, and doing detoxification routines like coffee enemas. If there's any of those components that you are not willing to do, there's really not much point in your setting up appointments to talk to me. It's very important that you understand that all of those things are necessary. Secondly, um, you need to understand that this is not a sprint, it's a marathon. In other words, look at this as a long-term commitment. If your idea is that you're going to do this for a few months or maybe a year and then stop, I would suggest that you go in another direction because this is a long-term proposition. That's what will be needed, in my opinion. Then I'd like for you to send in some information about yourself. And what to send in is spelled out on my website. Now, this doesn't mean you need to get every scrap of medical records you've ever had. If you don't have a particular piece of information, go ahead and send in what you have. But nonetheless, I'd like for you to tell me about yourself and about the situation you're looking for help with, because that way I can look at it and see whether or not I think I can be of help. Now, there are some situations that other approaches might be better. For example, localized cancer can frequently be cured by surgery, and so that's what I would suggest you do. I don't want you to travel long distances to come and see me or to wait a week or two to come and see me when there was some other way that I thought would be better for you in the first place. That's why we have this whole process in place. Now, please bear in mind that me accepting you as a patient after I've reviewed that information doesn't guarantee that I think that I can help you. It doesn't guarantee anything. No doctor can make a guarantee about a treatment plan. But what I do want to do is assess whether it makes sense, whether there's a reasonable chance that I can help you before we actually set up an appointment. That's why this whole process is in place. So please follow the directions on the website. And of course, if you have any questions about it, give us a call.